Hello, class. Now, as we continue with the community and public health and racial ethnic populations in America, we've seen that there are certain things that we really need to focus on. If you walk around or you go, especially in big cities, you'll find out that there are a lot of different people speaking different languages, even in their outfit, what they wear. And also, you go to the restaurants, you see different restaurants, ethnic restaurants, food. These are all differences that different people from different parts of the world who have migrated to America have brought with them. And also, style of prayer, their religious beliefs, different cultural beliefs, and for some people, this has become a kind of a challenge. Some people see this as an advantage for the country, and others see it as a demise for the country, for something that they used to believe in. And it's a real discussion because, again, those people who believe that, okay, diversity brings strength, bring a lot of possibilities. They appreciate the diversity. And some who do not see it that way see it as a threat that likely the privileges that they enjoyed might be taken away from them. And at times it's you from either side. You cannot say, okay, this person is right, this person is wrong. The only thing is there has to be a lot of discussion so that people understand each other, so that people understand each other's motives. Because as the name implies, the United States of America, we are all one, united, and we should work for the common goal of the country. So some of these racial divisions that have created some rifts among certain groups, especially for some politicians who take advantage of some of these differences. I think there has to be some real discussion so that people really understand that minorities do not come to this country to take over, but they come to this country to make it better, to make it even greater. And the United States is still the global leader when it comes to it, her generosity towards the world, towards other countries. And some of these things, again, we have to hope that politicians who take advantage in trying to develop or create rift must be educated about what each of this ethnic group brings to this country. Yes, there are challenges when you have people from different countries, at times speaking different languages, and also different food, different cultures. For some people who are not open to the progress, might perceive it to be a challenge. And it has to be explained. But when we bring this to the health, we bring this diversity, how does this ethnic group really, how does it impact the health of other groups, other minority groups? At times, there are some challenges in terms of their belief system. How do they perceive the health system? Do they have access to the health system? Where do they live? Do they have appropriate resources? What housings do they occupy? Are those housing facilities, are they crowded? Are they damp? Are they healthy houses? Do they have gainful employment? The community they live in, what are the resources in their community that promote health? I say because the more you have a community that has resources that promote health, the better the people living in those communities. The less the resources, the less the probability for them to have proper health, good health. So today we continue with some of the challenges. The infant mortality among ethnic minorities. This is a real challenge. The infant mortality rate. There's serious disparities in America among racial and ethnic minorities. You think of African Americans, infant death rate more than 2 times that of white Americans. Again, it goes back to resources. Level of education, level of care, and you can go on. See, when there is lack of prenatal care, because being pregnant is one thing, but how to monitor the pregnancy, to making sure that the pregnancy, the period of gestation goes well as it is intended. Most of the time, some do not have that opportunity. So when things go wrong, it does not only affect the infant, it also affects the mother. So the prenatal care is very, very, very important. the mother should be monitored in vitro, making sure that the child is receiving all the necessary nutrients that he or she needs to grow properly. And all the nutrients or all the toxins that are likely to be introduced to the features should be discouraged, like smoking, alcohol, poor diet. All of those things should be discouraged. Unfortunately, most of the time, pregnant women within some of this, within the African American populations, at times are subjected to some of these situations because of lack of resources. That's one. Because of also proper, effective medical evaluation. Because most of the time, even those pregnant African American women who are educated, have good insurance, at times end up succumbing to losing their child under the first year of life. So there is a need for the medical profession to really be educated in some of these cultural issues. Or maybe it could be genetic, but a great number of these things, some of it is cultural. It's how does the Black pregnant woman feels when they visit their doctor? What sort of relationship do they have? How far do they really go into examining how the child is developing, and also how is the mother dealing with it? Because it's not only infant mortality, but there's also maternal mortality. Mothers also die at childbirth or after childbirth. So some of these disparities in the health services have to be addressed. What is the root cause? Some of the reasons are known. Others, which are usually the racial attitudes, the lack of appropriate care, and at times also the trust factor wherein pregnant women stay away from doctors. And also, some not only stay away, but some don't and some lack the appropriate access, the appropriate education. And yes, some engage in bad behavior that contributes. So there is not just one factor, there are multiple factors. So it is all the responsibility for members within the community to educate African American women, even before preconception, to do away with bad habits. Right now, I can think of two main bad habits: smoking and drinking alcohol. And yes, drug use. Those are habits that need to be stopped, and they should be helped to be able to do away with these bad habits, because some of it is addiction. It's not as easy as as I'm saying it, or stop smoking and they stop, or stop drinking and they stop. Some of it, they have to go through some real professional care, professional treatment for them to be able to do away with some of these bad habits, because it will not only affect their own health, it will also affect the health of the mother. And during pregnancy, the vital signs of the mother should always be monitored, as well as those of the child. Blood pressure, sugar level, these are all things that have to be monitored. And also, you talk of cancer screening, management, incident and death rate highest Black Americans for various types of cancer. And part of the screening, again, it goes back to some of the mistrust that with through the years that African Americans have had with the professional, the health profession, wherein for some time, like the Tuskegee study, wherein Blacks, African Americans were used as guinea pigs. So now, even though there's been a lot of advances, and some of those advances have really increased, have really helped in promoting the health of Blacks, is still a problem. It's still a problem. So access to proper treatment, access to, say, go for checkups. First, start by trying to know your family history, because cancer is one of those things that could be transferred from one generation to the other. Check and see if within the family there's any family member that has died as a result of cancer or due to cancer. What type of cancer? Try to know the risk factors. And yes, some of this, the data shows this way simply because, again, access. See, education, access, and management. How well are they educated? How well is the Black community educated about some of these cancers? What are the risk factors? And what can we do to reduce some of these incidents or reduce the incidence of cancer death? And also educate the providers about some of these cultural barriers, cultural issues. You see, because at times when we ignore some of these cultural issues, even though our intentions might be great, might be noble, but the recipient of the service might not appreciate it. So maybe just take time to understand. Maybe people and the health providers should take time to know their patient, not just go by the 15 minutes or according to, patient comes in, your name and this or this, 1, 2, then you're out. Most of the time, people don't come out readily with what is really affecting them. You have to find ways to really get them to speak up how they feel. Because most of the time, people, everything being normal, people don't want really have fun spending time at the doctor's office. They might go, but they would like to get the hell out of the place as fast as possible. So, and the doctor should allow by asking certain questions, and motivate them, make them feel comfortable so that they can be able to explain how they feel when they started feeling it or what triggers that feeling. So because again, until people really work together, the doctors as well as the patient, some of these things will continue to just increase. So there are many disparities attributed to lifestyle factors. Most of the time, also, when it comes to late diagnosis and access to health care. See, with cancer, the amount of knowledge that's available, the amount of medications, the therapy, the good number of cancers can really be controlled or be put in remission. And one of the way is through early detection. So once it is detected at very early stage, the prognosis of the cure or the intervention will be very, very positive. But what are the things that make short and attitudes being possible? Is first of all the education. People have to be educated about their health. They have to know some of the possible risk factors. And they also have to do away with some of the beliefs that they have. Oh, I'm feeling this, but the good Lord will help. Well, the good Lord also have doctors as the extension of the good Lord. So most of the time for us is we have to make sure that when you're not feeling good, give your pain to the good Lord. But at the same time also go to the doctor to help in the healing process, because the doctors are the extensions of God's hands to help you heal properly. And some do not have access to health care. Thank God, at least the affordable health care that was put into effect by during the presidency of President Obama, has provided access for a lot of people, especially among minorities, because the way the American system works most of the time is, people are willing to help provide service when it's almost too late. See, access to healthcare is more primary, and primary helps with screening, cost less to do all those things to prevent. It costs more to cure, well, to treat, and in most cases, with poor outcome. There's less primary and secondary prevention in various minority groups. Less primary. Primary here is the education about things, health education about things that might cause them to develop some of those diseases like lung disease and bronchitis, colon and rectum, breast for female, prostate for men. You can see the various groups. Lungs, whites and black, almost about the same, but blacks are more. And one of the reasons is smoking. Smoking is not good. It's not sexy. It's not beautiful. It's just dirty, stinky, bad habit. We need to stop it in our communities. Even to the point of using cigar as a celebratory, there are various ways you can celebrate without using cigar, because cigar is just as harmful. You have Asians less than blacks, Indian, Alaskan natives less than blacks, and the list is Hispanics. Colon and rectum cancer. Whites, about 15%. Blacks, 21.5%. Have Asian Indians, Hispanics, less. And most of the time is also the diet. What do we eat? In addition to lack of access, we have to also look at our diet. See, is our diet of these three: high fat, high sugar, high salt? Those things don't help. Less fiber. See, because when we have less fiber in our diet, most of these things have a possibility of becoming problematic. Maybe we have to monitor what we eat. Prostrate. You have more blacks, almost almost two times the number of blacks that will die of prostate cancer. And most of the time is late diagnosis. When the disease is diagnosed late, it's very difficult to cure. You have 20.1% white, 48.2% black, 9.5% Asian, and 19.6% Indian, Alaskan natives, and 18% Hispanics. See, so these are, again, some of the things is we have to look within our lifestyle. What are the things that really contribute for us and contribute to us or blacks disproportionately being affected with a dire consequence of these diseases: the lung cancer, colon cancer, breast cancer, and prostate cancer. Cardiovascular diseases. Death rates vary widely among racial and ethnic groups. Black Americans have higher rates from cardio. Now, Black Americans have higher rate from cardiovascular diseases and stroke. One of the biggest reasons is there's a high rate of hypertension as a risk factor. Yeah, and also varies according to race and ethnicity. Black Americans tend to develop hypertension earlier in life than white. In fact, it's even now there are people in their early teens and late teens that have started developing hypertension, especially for the African American male. And some of those things But again, it depends on, some of them are diet related. Those high salt, high fat, high sugar, obesity, lack of exercise, and yes, perpetual stress, living in an environment wherein they are always stressed. That stressful condition encourages certain chemical reactions that is likely to elevate their blood pressure. So, diabetes, overall prevalence has risen in the US in recent years. Prevalence in those 20 and older varies in minority groups. Increase in age adjusted death rate in all racial and ethnic groups. But again, as with any of these other health related issues, significantly higher in minority groups. And some of those are the triggers of some of those when we talked about the social determinants of health, where people live, the conditions, the services that are available, types of services, quality of services, access to medical care. Food type. See, all of these are things that one way or the other creates some challenges. HIV infection and AIDS. Proportional distribution of AIDS cases has increased in African Americans and Hispanics. Again, some of this is lifestyle. At times, some of it is poverty, especially for women. Engaging in unprotected sex. Have sex for money. Have sex for food. Without the appropriate protection needed. See, when there is a prevalence of unsafe or risky health behaviors and lack of access to health care to provide early diagnosis and treatment. So most of this, part of it, a good chunk of it is poverty. See, because when people are poor, they can do whatever to make sure that they get those things that they want. And at times, some people who have those things that they want will be those people that can give them the infection. And that's it. And most of the time, even though some women might ask, can you put on a condom, please? They say, no, if you don't want plain sex, direct, flesh to flesh, I'm not going to do it. And at times, women are left with not so much, am I going to engage, or when and how many times. And also, we also have the not only men and women having sex, but we have also men and men having sex. And at times when people don't know their sex history, the health of their partners, they expose themselves to having some STIs, which might include HIV, which, when not treated properly, can lead to HIV and can lead to AIDS. And AIDS kills. Now you have people who are living with HIV because of good medical care, medical intervention, much longer. So, but if you wait longer to have access to those care or those type of treatment, your immune system is wiped out. AIDS, the HIV converts to AIDS, then your health outcome is a challenge. And most of the time, the health outcome is usually poor. Child and adult immunization rate. Older adult immunizations rate are substantially lower in minority groups, even though an overall increase has occurred. So even right now, when we are talking about with the COVID vaccination, there's still some hesitancy within minority population. Again, based on past history. But my advice to our people, to our families, to our neighbors is, please, when you have the opportunity to have the vaccination against the COVID, take it. There are a lot of things that have been exposed due to COVID. And some of those things, once they've been exposed, can be addressed. Yes, things went wrong, way, way wrong. Yesteryears, when blacks were treated as guinea pigs. These days, I don't want to say it doesn't happen, but if it's happened, it will come out and that person will be penalized. And that person will be taken out of the medical profession. But for the sake of your family, for the sake of your own sake, take this virus medication, the COVID vaccination, and also use the mask as much as possible, because that's the only way we're going to be able to control the spread or the various groups of this COVID that is coming around. Put on the mask the right way. Depending on what you have, two layer it. And also keep a 6 feet distance. People you don't know. And wash your hands as often as possible. Because until we know and we have this virus under control, life is not going to be normal. The only thing that is going to be normal is seeing family members being buried. And that is not a good sight. So let's do our part. The social determinants of health and racial and ethnic disparities in health. Many factors contribute to health disparities. You see, all of those things that we just went through, those are all great. Well, again, what is the root cause? Now, here, they've given us a strong explanation of some of the root causes. Many factors contribute to health disparities. Strong association between social determinants of health factors and health outcome. One, education, level of education or lack of education. Education, level of education, quality of education. Because your level of education, your quality of education, to an extent will determine your level of income. Poor education, lack of education will lead to poor income. So that's why we should really cherish education, take full advantage of any educational opportunity that is presented to us. And when your level of income is low, you fall below poverty rate. And when you are poor, you have little or no influence in determining what environment you can live in. Most of the time, the environment you can live in is much more likely to be a poor environment with lack of resources, with little or no access to health care, and with housing that is poor, that is polluted, environment that is polluted, services that are poor services, convenience stores that will only serve you processed food instead of going into groceries where you have the selection of the type of food that you might want, healthy food. And also you live in a poor environment. Most of the time the schools are also poor. You get poor quality of education. And poor quality of education will land you to getting lower paying jobs. Your income is not good. And everything else goes downhill. So this is not, it's one thing that, okay, in some situations, yeah, we can really go with the idea of, there are certain things that are much more pronounced. But these three are just so direct. There might be other variables, but these three are so important. Your education, don't take it lightly, because your level of education can either be high level of education, can be high quality education, or poor level of education, or no education. Then it will determine the level of income, what sort of employment you can get, what type of employment. As you can see, with COVID again has exposed this situation. Those people with little or no education lost jobs, rely on the government for services. And most of the time, the government can do as much, especially these days wherein you have different attitudes prevailing within our political systems, wherein some people are willing to help as far as they can go, and people who are just, hey, you take yourself, by your bootstrap, and so again, these are all challenges. Then when you are poor, because of the type of job, you don't have quality insurance, you lack access to health care. Most of the time, the probability for you to engage in poor habits, poor self-style habits increases, and that can lead to poor health. Now you can see here, social determinants of health and racial and ethnic disparities. So you have your biology, say race, affect varies by gender and age. It starts there. But your biology, your culture, socioeconomic status, said also racism also plays a part. Political plays a part, the political system, the historical baggage that some people still live their lives. Some people who still don't believe that, well, blacks can be just as good as white when provided with the right type of opportunities, the right type of climate for them to prosper, the legal system, the justice system. See, all of this level of anxiety that some ethnic groups, some minority groups face on a daily basis just because of their race. And yes, you have also the health practices, smoking, alcohol, nutrition, and again, sexual activities, engaging in unprotected sex, give rise to STDs or STIs, sexually transmitted infections, such as HIV/AIDS. Then you have the psychosocial stress that young men feel, and especially African American men face on a daily basis, regardless of how educated they are. Whenever they get into some of these predominantly white institutions or workplaces, there's always that, do these people really think I'm what I should be here? Do they think, okay, I'm here because of affirmative action? See, most of the time, your level of quality is not appreciated at face value. They always have to create some reasoning why you are there. And psychologically, that does not really do well for you. Smoking, alcohol use, nutrition, and others. You have the other environmental stressors where people live. Most of the time, again, people live in certain environments that are poor environments, filthy, slums, poor drinking water, poor sanitation. And all of these are factors that some of them can be due to racism, and some of it is also just because of certain policies that are put in place or certain opportunities that are made available to certain people, they cannot be able to escape those situations readily. And occupational opportunities. What sort of occupation do people have? It goes back to those three things: your education, your income, and poverty. Those things, if you look at this diagram, you see how they all play a part. Then you have the legal and medical system, the medical care, wherein, okay, you have your medical care is mostly determined by what sort of medical card do you carry with you. If your insurance is not good, most of the time that becomes, and most of the time, what gives you that good medical card that we call insurance is the type of job that you have. You don't have a good job, you don't have a very good medical card. And because of that, you might not just have a good health care service. So there are needs, access, and quality. Equity in minority health. As with anything, simple solutions are not easy to come by. Solutions to problems for one group may not work for another. But I think if we start with providing equal opportunities for all the groups to have access to quality education, and also develop the equal system that provides access to quality living places where people can live, houses, do away with some of these red line laws. Maybe we might start to have some ways in which some of these things can be solved. Can it be solved for all groups? No. Is it one size fits all? No. But it can go a long way because there are certain cultural issues, there are certain beliefs that at times also that can affect people's perception of the healthcare system, how they access the healthcare system. And also in some minority group, there's the barrier, language barrier. How best do those barriers being treated? How cultural sensitivity, very important, because we all speak English does not mean we all have the same cultural belief system. So providers should go an extra mile to really study how some of these various groups, the various diverse groups that makes America so diverse, that gives it that strength of diversity, but at the same time provides it with that many challenges in dealing with some of these cultural nuance so that they can be able to access these people so that they can provide meaningful and relevant services to all the groups. Must empower individuals and communities. The people at the end of the day, we can have all the services available, but people have to also take advantage, take advantage to improve their own health. The communities have to provide those resources, create those conditions that will promote the health of their members. And health literacy. People have to know about their health. They don't, when you say health literacy, it's not to be a doctor, but is when I feel sick, when I feel this way, what do I need to do? You go to your doctor. Doctors have studied some of these things. They can tell you what you need to do, what sort of medication you need to do, and also try to know the risk factors. If, for instance, hypertension is common within your family, try to know what are the risk factors. What is it in this family that we do that predisposes us to hypertension? See, because it's extremely important. It could be our biology. That's a factor we inherited, it's in the blood. Or maybe it could also be our lifestyle, what we eat, what we drink, how much of it, how much exercise, how frequent do we go to our doctors, and how much confidence do we have in our doctors? Because again, when you don't have confidence in your doctor, that can also be a challenge. You're talking about cultural competencies. Okay, we're going to stop here for today because there are so many factors that can contribute to the health and the health outcomes of a country like America with so many diverse population, so many diverse ethnicity. And yes, there are a lot of advantages that the diversity brings, but it also brings a lot of challenges. But those challenges can be solved if people take time to study, to know each other, and start by saying, okay, every human being is the same, depending on what you believe. Because most of the time especially politicians like to bring in God into the picture. Well, if you believe in God, then you should believe that God said all human beings are his children. And I said politicians because they make policy. They should make policies that addresses all children of God. Okay.